I'm going to jump right into this, and I'm just going to ask our panelists if they could just introduce themselves, maybe speak a little bit about their relation to the work, as well as maybe just, their own reaction kind of take on the film. And we can start anywhere we would like to. Don't all go.
Good evening, everyone. My name is Barry Campbell. I'm 53 years old. My rap sheet is 33 pages long. I am what you call a systems baby. Foster home, boys home, jail, and then prison. I currently work at the Fortune Society. I do a lot of testifying, City Hall, Albany, DC. I do a lot of hosting of elected officials who come to my agency. And I'm a big advocate on reentry and prisoners' rights and equality and justice.
Maybe your reaction to the film, Barry?
My reaction tends to be a little bit mixed because I am a former inmate. I'm one of those people that believe, if you're going to shift around buildings and not shift the culture, you're going to have a problem. And for me, the problem with most city jails in New York City is that they're run by the old guards. And the old guards set the tone. We don't set the tone. The inmates don't set the tone in the jail or the prison. The old guards do. And the old guards, most of them now, depths, captains, and commanders, they believe that if you put a stick to somebody's head, you'll get the results that you want. And that's the problem with it, because as the new corrections come in, that's what they're told. They're not given that in the manual, but when they go into the locker room, that's what they're told. So that's my reaction to it.
Thank you. Whoever wants to go next. This is a democratic process.
Let's not be shy, people.
I won't call them anyway. I feel like we can just jump in.
Okay. Is it on? Yes. All right. I'm DeAnna Kaplan. I am with the New York City Mayor's Office of Criminal Justice, and I'm a deputy director there, overseeing our efforts to close Rikers. And so that is obviously a relevant topic for the film. I think that is an important point, obviously, that we can't, it's the conversation about buildings has to be connected to a conversation about culture change. I do think that the film indicated that, but I think that's not one that we can lose. And I think that the film did a great job at talking about the challenges of Rikers Island and what we're seeking to achieve with its closure. I will say every time I personally look at images of other jails as models in the U.S., I don't see many, if any, jails in the U.S. right now that actually stand out and say, physically that's the model. So I don't look at those images and say, that looks compelling. I see people that are doing things better than what's happening, and I see a lot of indications of what we could be doing far better, but I also don't want to, as we go through this process in New York City, to be limited by what the models are that we see in other places around the country even. It's important to learn from those and look at those, but I also actually want us to think even beyond that for what's possible.
Thank you.
Hi, my name is Lauren Brooke Eisen. I'm a senior fellow at the Brennan Center for Justice at NYU School of Law. I'm thrilled to be here today, and I work in our justice program where we focus on conducting research and drafting policies that will reduce our nation's reliance on incarceration. So our program's mission is actually to end mass incarceration. So we publish a lot of reports finding that almost 40% of Americans are unnecessarily incarcerated only if we look at public safety, and we stopped there for time. And so all of my panelists and probably all of you in the room know that we have far too many jails and far too many prisons in this country. We have a long way to go to reduce mass incarceration. I think some of my reaction to this film is that Rikers Island specifically, and so many of our jails and prisons are enormously dehumanizing. Rikers specifically, but a lot of jails and prisons across the country are dirty. The incarcerated people inside are treated like animals. sometimes called by number, not by name. And we have so much research now in 2019 indicating that jails and prisons do not improve public safety. In fact, for the most part, they tear apart families, tear apart communities, and make it virtually impossible for those who are released from our jails and prisons to successfully reintegrate into society. So I think this film does a great job of, showing what's happening in terms of Rikers Island, but we have to look across the country with 2.2 million people incarcerated in America, and that doesn't even include any of the people who are behind bars in our immigration detention facilities. So we really have a long way to go.
Thank you.
My name is DeAnna Hoskins. I'm the president of Just Leadership USA, where our mission is to cut the correctional population in half by 2030. And we do that by investing directly in the leadership of directly impacted individuals. We believe those closest to the problem are closest to the solution, but furthest from resource and power. Prior to this position that I've been in less than a year, I was the senior policy advisor at the Department of Justice, overseeing and managing the Second Chance portfolio of funding, the National Reentry Resource Center, and appointed as Deputy Director of the Federal Interagency Reentry Council at the time. My reaction to this, being a directly impacted individual, being an individual who has had a unique experience of being able to work inside the Department of Corrections, I believe, for me, even being featured in the film, The Snapshot, I believe the film was a commercial book. Because the issue is so deep-rooted, not only within the jail, the culture. We do nothing to talk about the communities and the trauma of individuals entering jail and how that exacerbates or tops the trauma that individuals are coming. So it's a bigger issue, but the issue we're talking about is about closing Rikers. And when I toured Rikers, I had never been to Rikers, just the operations and the lack of safety and security for the employees was amazing to me. I had never seen, working around the country, I had never seen a jail complex or a prison operate with such lacks of security for its staff. The operations were very antiquated, outdated, and I remember my question to control was, if a riot breaks out, one of the protocols for any prison or jail is within the first 10 minutes, you are to identify where your staff is and that they are safe. And they still were operating on pen and paper of who was signing into the facility. And the guy said, well, read the papers. I said, but all hell just broke loose. Papers are everywhere. So how do you even maintain the safety and security of the people you employ has not even been brought into this conversation. And then when we move into the individuals who are detained there, and I think one of the things that stuck out to me, and I'll pass this on, is as I walked Rikers Island, it reminded me of a community with trash and everything out on the yard. And every jail and prison I've ever been to, I've ever worked at, is the most pristine, cleanest place you would be, but that was not at Rikers Island.
Thank you. So my name is Homer Benners. I'm a physician. I was the chief medical officer of the New York City jails and worked in that system for about a decade. And I now work for a nonprofit called Coaches Community-Oriented Correctional Health Services, and we help communities around the country create diversion pathways, also improve health care behind bars. My reaction to the film, and I should say, having just written this book, Life and Death in Rikers Island, where I really try and make the case that I think we need to make in this country, and I don't hear in the film so much, is that these places confer health risks to the people who pass through them. So we talk about all the trauma that people come into these places with. It's certainly true because we've criminalized having a behavioral health problem and being poor or being a person of color, but we don't measure all the things that are done to the new health risks that happen, that people are exposed to. So even in this city, right, where we built the most sophisticated injury surveillance system in any jail, probably prison in the country, we still don't know how many of the deaths that happen every year are preventable or jail attributable. And that's a shame. on us, because we know about preventable hospitalizations in medical clinics, right? We measure it. CMS tells us to measure it. The Center for Medicare and Medicaid Services tells us to measure it. We know when infections happen after IV insertions in hospitals, but we don't measure these outcomes, preventable deaths, injuries, because all over the country, because we don't care about them still. And so when I think about closing Rikers, which is an absolute mandate, we absolutely must do it, we still haven't really committed to two ends of the problem that are much deeper than we really acknowledge. One is to really measure the level of brutality and health risk that we expose people to who keep going to jail. The other is that we have yet to really tackle this idea that mass incarceration is a product of all of these elements that started before the 13th Amendment, but certainly they went through Jim Crow, and really importantly, they went through urban renewal projects, where whole swaths of the black middle class and poor middle class were wiped out. If you take a picture of downtown Pittsburgh, incredible, you see the stadium where we used to have thriving middle class families living. So that is important, because as those changes happened before the war on drugs, we also were wiping out access to mental health services and education and employment. And so then when we think about closing Rikers, we have to think about how do we, I just met Mitchell Jackson, this great author, for the first time, and he talked about we were never rehabilitated, so how are you going to rehabilitate these communities? And so how do we build employment and health access in communities that don't have it today? Because otherwise, if we just narrow the aperture of entry into a jail or a prison, people still have the same law enforcement contact, right? They still could have problems out on the street. They still go to the emergency room. They can't take care of them. So I think that we can't contemplate, we shouldn't be worrying about the size of the jail without thinking about what are we going to build in the community to keep people from getting back there.
Thank you, Homer. And that almost kind of great setup for my next question, right? And I think it's that, right? How do we have an informed conversation, right? If we really want to, Angela Davis says radical simply means going to the root, right? And it feels like we haven't gone to the root of these issues. Yet, to your point and to DeAnna's point in many ways, how do we situate this conversation into the larger context of mass incarceration, which doesn't feel like we're doing a good job of it?
Thanks. And I love that quote by Angela Davis, because it's gonna take a hard conversation. I think we've been penny pitching, and I always say when there's an infection, you don't put a topical cream over top of it and say, I'm just gonna heal it from the top. You get to the gut of it and you heal it from the root cause. So we know part of the root cause of how we got to mass incarceration started from slavery. And I like when Brian Stevenson says slavery never ended, it just morphed into mass incarceration. And when you were talking about the black codes and things that were illegal for black people to do, even when those laws changed, they still created black codes that actually targeted black community, black and brown bodies. And I think for me, the reality was, we're gonna have to talk about this conversation, and I'm no longer willing to say, we need to do sentencing reform, we need to get rid of mandatory minimums. And we do, but the bottom line is, we have to talk about how we got there and then start dismantling, because what happens with criminal justice reform, and we saw it on the federal level with the First Step Act. Even when they called it and taught it as the best criminal justice reform, and I like this quote that it was bipartisan. Well, the war on drugs was bipartisan at the time. Let's just be honest. It had a consequence that was unintended. So I always tell advocates, laws play out different in certain communities. And even with the law, with the First Step Act, with the sentencing reform, and even the early release having access to go home, certain crimes were carved out. And when you look at the crimes that African Americans and Latinos are convicted of, those were the crimes that were carved out. And I like when someone said to me, this is the answer to the war on drugs. And I said, no, because the charges that went with the war on drugs are the charges that got excluded. So you excluded a whole element of individuals, even in something you're talking as criminal justice reform. And if we don't talk about that, if we don't have an honest conversation that even in a bill where you put the people accessible to this privilege have to be low-risk individuals, you sent a manipulation kind of context to society, because society thinks low-risk people are low-risk charges. I can commit murder and be low-risk. So that's not true. So the perception that was sent to the public, and the bill went against all best practices, and it said low-risk individuals, when research says high-risk individuals should get your recidivism reduction programming. Well, Black and brown people score high on risk assessment tools, not because of their own issues, but because simply how our communities and our schools are over-policed. Our schools have more school resource officers than we do guidance counselors. So our first interaction with law enforcement is going to happen at a much younger age, and those are the static questions in a risk assessment that starts to evaluate if you have eligibility to even get into a program in prison. So now you started to even exclude us of access inside prison. And if we don't have that real conversation, where some people are going to get uncomfortable, and I just say this, people are going to get uncomfortable with this conversation, but there's a whole host and a group of people who've been uncomfortable. So it's just time for everybody to get uncomfortable.
Thank you. Anyone else want to jump in, or I feel like maybe the mic was dropped? I don't know if we need to continue down that path. Thank you. So maybe the next question, and thank you for Angela Davis' reiteration, but, and again to Angela Davis, prisons do not disappear social problems. They disappear human beings. Homelessness, unemployment, drug addiction, mental illness, and illiteracy are only a few of the problems that disappear from public view when the human beings contending with them are relegated to cages. How do we not make jails and prisons our social safety net? And how do you believe these new community-based jails can play more of a restorative, preventative role in marginalized communities most impacted?
So, I think that's a very important two-part question.
Yes.
I think one thing that is actually important in the framing, or not the framing, but the context for the effort to close Rikers is, so it is about, obviously, closing the jails on Rikers Island and developing 4 borough-based facilities that are more integrated, connected with the community, which have to do with how can there be different levels of community engagement, participation, access to the facilities, all sorts of implications there. But I think it's also important just to frame that it is fundamentally also a decarceration project, in that there is a commitment to reduce the size of the system itself. So the film talked about, historically there was over 20,000 people in jail in New York City on a given day. When the mayor took office, there was 11,000 people in jail. And so that was, a whole series of policy decisions that, helped produce that shift from over 20,000 people in jail on a given day to 11,000. When the mayor made the decision to close Rikers Island, driven in large part by a broad-based effort, as acknowledged by the film, of many different community organizations and directly impacted folks like Just Leadership and others, who waged a very effective campaign to bring this to the forefront of New York City. But it was with a commitment to not only say, okay, we're going to close Rikers Island, but also we're going to make a commitment that actually we're reducing the population another 50%. So there was about 9,500 people in jail when that decision was announced. And the mayor said, we're going to plan for no more than 5,000 people. So right now, since we have made that decision, we have actually seen a more aggressive reduction in the number of people in jail on a given day. So that we're seeing the numbers just continue to go down. It's under 8,000 now. That's the lowest number of people that have been in jail in New York City since 1983. And there's I think we're looking right now as to whether the state legislative reforms that were just passed, again, because of the work of a lot of different community organizations and justice-involved individuals on bail reform, on speedy trial and discovery, and other legislative reforms that are still pending on parole reform and maritime and a whole range of things, whether that means that actually we can even continue to shrink the system. And so when you talk about a commitment to reduce the size of the justice system altogether, it helps to prioritize and force other policy decisions, right? So there are a whole range of things that have helped to reduce the jail population, but some of this is an investment in supervised release, and we're going to have to continue to invest in supervised release. And let me be clear, supervised release in New York City is not electronic monitoring. It is actually nonprofit organizations who have social workers who are working with people who are court involved and following up. It is a whole investment in alternatives to incarceration and alternatives to detention. It's funding for things such as the Mayor's Act. We've got a program that works with the 15 NYCHA developments that have some of the highest levels of crime to fund things like extended hours for community centers, or the very, very effective cure violence programs that, based off of a public health approach, use violence interrupters at the neighborhood level to actually address gun violence. And there's been an infusion of funding into that program, and I think we'll see that continue to happen. And so I do think that sometimes when we just talk about, what do we have to do to reduce the size of the justice system, and we're going to plan for that, and we're going to everyone eyes on the prize, let's focus on that other policy decisions become forced to the forefront. And I think that's an important goal and something that needs to be, I think, or should be elevated, that part of this effort to close Rikers Island and part of the call that was made by all the organizations on this was close Rikers Island, replace it, and we want to see it in half. And now I think rightfully so, advocate organizations are saying, and let's not stop at that goal point. Let's keep on thinking about how we can reimagine what's possible, but set goals, reach them, and keep our eyes on what the end goal is here.
Just sort of picking up on that point, I worked on the Justice Reinvestment Initiative for a number of years, and that's federal money that the Justice Department provided to states to reduce their correctional populations. And for years, the justice reinvestment work really focused on the lower level crimes, marijuana possession, low level cocaine possession, nonviolent offenses. And we really, as we continue to drastically reduce not only New York City's jail population, but jail populations and prison populations across the country, we have to move beyond, as DeAnna was saying, these sort of conversations around just nonviolent offenses. In New York City, you can be convicted of a gun charge. If a gun is found in your car and there are 3 of you, that's a violent offense. And no violence was actually committed during that, in that situation. And these are conversations we're just really starting to have for the first time. As we talk about culture change, and the film talks a little bit about culture change on Rikers Island within New York City, we really have to educate the community of New York and across the country so that we can drastically reduce our prison populations and also start changing our laws and practices so that less people who have even been convicted of violent offenses are sent to jail. Because exactly what DeAnna said, a lot of those people are low risk and can safely work and thrive in the communities, and they don't need to be sent to in cages.
I guess I'm the radical one up here, because at the end of the day, if mass incarceration is your problem, you have to look at the issue that created mass incarceration, as Dr. Kirk said, going back to slavery, Jim Crow, and all those other things. But the piece that we have to talk about right now is investing in our communities, because our communities are built up, it's comprised of human beings. I don't care if they're black, white, brown, purple, or orange. They're comprised of human beings. And if you're an individual that says you have some sort of compassion or some conscience, How could you purposely walk down Bedford-Stuyvesant and walk through the projects and see everything that's going on in there, and then walk up on 96th Street on the west side and see everything that's going on up there and be okay with that shit? Excuse my language. And be okay with that. Because I'm not. I'm not. Stop and frisk only came to Bed-Stuy. You know, stop and frisk only came to the $1 million blocks that Jeremy Travis identified for us. And if you take a look at it, the investment in those same communities that made the $1 million blocks have gotten less or next to nothing. Next to nothing. PAL clubs closed down. Boy Scouts, Girl Scouts move out of the hood. YMCA starts shutting down in the hood. You know, you start looking at these after-school programs that were going on in the schools, they're shut down. We took out the security officers in school and replaced them with police officers. So now what you're doing is you're targeting the younger people of the community because you've already destroyed the adult lives. You've already destroyed them with your broken window policies, with your mass incarceration policies, with your drug laws, with your war on drugs, with your Rockefeller drug laws. But when it comes time to invest some hard currency into these communities, there is nothing. There is absolutely nothing. We get the bare minimum. And I'm not saying this to come out as a racist or anything, but you have to take a look at the hard reality of things. Take a look at the school up on the Upper West Side versus the school down in Bed-Stuy, versus the school down in Bushwick, versus the school down in Brownsville, versus the school down in East New York. When you take a look at these things and you walk through those schools and then you walk through the other schools, you say to yourself, but how is this possible? How is this possible? It is designed that way. It is possible because nobody's putting money into the hood. They don't consider us part of the human race because if you did, you'd be invested in our communities. Because communities are comprised of human beings, not of black, white, brown, and purple people. They're comprised of human beings. And the problem that I have with this is that they stopped looking at my community as being human beings. They started looking at us as chattel. You know, when you start talking about back in the 1990s when the prisons started going up on Wall Street and turning into stock for people, that is by design. You know, when Bush was in office and we went to some great big conference out in Cleveland, and they brought a whole bunch of people out there, and they flew my boss out there. My boss turned in her plane ticket, her first class plane ticket. We rented a 16-seater van, and I took clients and staff out there. And I went to a corrections symposium, and when I walked into this big stadium room, they were selling everything from shackles to fences to barbed wires to the boxes that you put on the cup. Everything was about money. It wasn't about public safety. It was about money. And when it becomes about money, you stop caring about human beings. The other thing I want to point out real briefly, and then I'll stop. I am a chameleon. If you send me to hell, I'm going to try to unseat the devil. If you send me to heaven, I'm going to try to be as close to God as I can get. Wherever I go, I'm going to survive. So it's not about my personal safety because I'm 53 years old and I've survived it all. And when I talk about things like this, I'm talking about people that say, I'm compassionate about human beings. No, you're not, because if you're compassionate and you see this wrong thing happening and you say nothing, you are part of the problem. I'm sorry, folks. I get a little heated because this is my people. I'm sorry.
No, thank you.
I'm sorry.
Much appreciated. Let's sit in truth. Yes. You know, so thank you. Homer, I'd love for you to jump into this question, you know, just because so much of this ties into your work. And maybe, like, we've gone a little bit away from the question, so let me just reiterate it really quickly again. How do we not make jails and prisons our social safety net? And do you believe these new community-based jails can play more of a restorative, preventative role in marginalized communities most impacted? Exactly, you know, what was just expressed.
I do want to give New York City credit for this incredible decarceration move that is not present in most big cities in this country. So a lot has been built, a lot has been done to keep people away from the city jails that you don't see in other places. I think as a principle, though, I don't believe in unjailing people. And this is my kind of like principal problem with the First Step Act. I do believe that people who are in jail and prison deserve ethical care. That's why I believe a human rights framework is essential for these places, because rights are violated all the time. Like brutality flows like water through detention settings everywhere in the world. It's just part of it. So if you're not looking for it, then you're not caring about it. So I believe, having run the health service, that it's important to document and hold people accountable for abuse. But I think that, you know, the path forward is to not put people into jail, to not have seriously mentally ill people in jail, to not have restrictive housing units that are full of people with intellectual disabilities, which is true all over this country. I think that if we don't build community-based structures, not just employment and not just education, but access to healthcare, access to social services. Can you imagine what it's like to have, I trained in the South Bronx, and I can tell you that for a family who has a child with an intellectual disability, the choices they face are horrible. They just, compared to, where many of us live that are not the South Bronx. I mean, some of us do, I'm sure. But the point is the lack of services, the lack of access to things that help you navigate just the normal difficulties in life does steer people back towards law enforcement contact. And until we address that, I do believe that the borough jails are better than Rikers. Rikers absolutely has to close. I just don't think it's at all sufficient to solving the problems that we're talking about.
Thank you. We're going to ask one more question to the panelists, and we're going to open it up for questions. Or questions you may have, start to think about them. And maybe the last question is really in relation to some of the things Barry brought up, and some of the things you've all mentioned at various points tonight. But it's how do we begin to shift culture, around jails and around the people in them? How does this happen?
So I know one of the things around culture change is, I always say we can't train our way out of implicit bias. So that's unheard of. That's not realistic. But a culture is created by the top up, and it's acceptable, and it becomes acceptable. And until you start holding individuals accountable, but when you have a culture where the majority of individuals act a certain way, a person who's acting with human dignity, treating people right, becomes the outcast and more threatened, because that's not the culture that has been generated. So if the administration within DOC had the ability to change the culture and hold individuals accountable, have a zero tolerance for certain things, but let's be honest, we have a union that has some rules and regulations that push back as well, so there's some different things, but culture shift changes with the individuals in charge, holding individuals accountable, and not allowing, and I like to use this example, and I watch this, I'm new to New York, so I'm learning a lot about unions in spaces where unions don't exist in other parts of the country. And I was amazed that there was a teachers union. And I was amazed that a teacher could be underperforming, causing harm to kids, and because there was this union, it would take 2 to 3 years to remove that teacher from a school. And then I thought about how many children had been impacted by the time because of the unionized process, which is they were comparing charter schools, but that was just amazing to me. So when you think about a Department of Corrections with over 8,000 employees and has a certain culture and individuals are cycling through, how much harm is being caused? Again, culture is shifted by the administration being allowed, leadership having a zero tolerance, and I always said it, I said it was when I came to just leadership coming in a transition, and I remember someone saying, how do you change culture? I said, sometimes you change culture that you might end up being the only person in here with a computer and starting over. And sometimes it takes starting over, and that's what we're asking with DOC is we don't want the Department of Corrections to run the new barrel-based facility because we're asking for a public health model. We're asking for individuals to be invested in human beings. And there's a part of this campaign that everybody seems to keep forgetting. It's close Rikers build communities. Close Rikers build communities because the communities that have been most harmed by incarceration has been divested in for years. And if we don't ask for a reinvestment of those funds back into our community, what we know is any savings in any state, any parts of the country, goes to plug other holes and not the most marginalized communities. So that is the biggest part of it for us is shifting to the build communities component and starting to build the capacity in our communities on a grassroots level that allows individuals to be able to service the individuals that's a different approach around culture as well.
Thank you. Anyone else want to tackle this?
I just want to make a plug. I have really come to believe that the most important element to transforming culture is transparency. These are places, jails and prisons, 5,000 of them around the country, that are paramilitary settings. They are built to keep prying eyes out. That includes New York City jail system. And what that means is that we will not have sustainable culture change as long as there is not an appetite for transparency. And because today, I mean, we continue to read articles in the paper, but as long as a person can be taken out of a cell, taken to another part of the jail where they can be abused, they can be neglected, whether it's health staff or security staff, whether it's detainees themselves, as long as those things can happen and nobody knows about it, we will have abuse and we will have neglect and human rights abuses. And so I don't believe that culture change could take root in settings where we have not established transparency, and that I have yet to see very many jails that have done that, certainly not our New York City jail system.
And I think when we talk about culture change, it's broader than just our jails and prisons, our entire justice system. So we need to change culture and practice in our district attorney's offices. At the Brennan Center, we're working with district attorney's offices to train junior and mid-level prosecutors and provide experiential opportunities. Believe it or not, there are felony prosecutors all across the country who are recommending sentences of decades in prison behind bars, and they've never been to a prison or jail themselves. They have no idea what it's like to be in one of these facilities for 1 hour, let alone 10 years. So culture change is incredibly important within corrections. But our entire justice system really needs to go through transformational culture change.
I just want to say this. When I first came home from prison in 1991, I promised myself I wasn't going to do what everybody else did for me. Tell me a bunch of lies about what prison was really like. Nobody told me about stripping down, bending over, and spreading my butt cheeks and coughing. Nobody told me about wiggling my tongue and twinkling my toes and getting strip searched every time there was a need for them to strip search me. Nobody told me about the true dangers that I was going to face, not only from the staff, but also from the inmates. So one of the things when I came home, what I did is I went right to the corner store in front of the bodega, and I looked at the bunch and said, you lied, and because not everybody can be a gangster. And if you listen to the stories in the hood, everybody's a gangster and a killer. Everybody was the dude that had the house on smash. You're all lying. Ain't but a couple of dudes that can do that. And when I came home, the first thing I did was I looked at the dudes that was young like Roberts, when I used to look up to them like that. Oh, wow. And I told them the truth. I was humiliated, I was degraded, and I was treated like less than a human being. And I told them the truth about it. You know, people like Kirk and myself, when we come home and we tell the truth about our experiences, it makes people open their eyes to what the real world really looks like. So for me, being part of the formerly incarcerated people, I try to educate people on what really happens to you when you get incarcerated, what you're going to face, what you may experience, the dangers that you have to be aware of. I had a gentleman come to my agency the other day, nice gentleman, Upper West Side, prominent family, money coming out the wazoo, never did time. He said, what do I need to face? He said, no, because as soon as I get there, I'm going to get this. I said, you ain't going to get a damn thing. Don't get nothing, because everything you bring in is more danger and more threat to your life. He just sent me a letter maybe 2 months ago, and he said, you know what, Barry, you gave me the best advice I ever had. And I said, that's because I didn't lie to you. Stop lying to people in your community about what jail and prison is really like, what you really experience. And for individuals that have never had criminal justice contact, read a little bit more about what's happening and leave the damn television alone. Because what you need to know is not on the television unless you're watching BBC or Channel 13 or the Discovery Channel. What they depict about formerly incarcerated is not always true. If I came up here and didn't tell you that I was formerly incarcerated, you couldn't look at me and tell me that I was. So it's not true. My rap sheet is 33 pages long. I'm 53 years old. My last time in jail was in 2003. Thank you, people.
And I'll just really quickly I think, kind of affirm and maybe thread some of what everyone up here said. So the culture change writ large, how that happens it has to happen on so many levels. And so, like, exactly as DeAnna said, that comes from the leadership of DOC and the Department of Corrections, and there's things within that have to do with training of staff and staff qualifications and what does accountability look like within, and programming and all of those things, and just what's the mindset and the ideology and the philosophy, and and how do buildings such as these support that. But it's not just bricks and mortar. It's about what happens within those places. I think the transparency question is obviously very essential, and I actually think that one of the things that we've talked about when kind of going back to this question of, like, well, what's the difference of a borough-based facility? And sometimes people talk about, like, look at what's happening at the federal facility in Sunset Park, which is obviously deplorable. And, that's right there located in the middle of Brooklyn, and that's not any better. But I think the actual really powerful thing that we see at MDC in that facility is that when there was no heat and no electricity, hundreds of people could show up outside of the building and say, bang on the windows, flash the lights if you're okay. You could have a number of different local elected officials show up at the door and say, I'm coming in, and we see what's happening here. And there is a really big difference in actually being able to have that level of just direct community oversight. Now, that doesn't mean that we don't need actual formalized ways for transparency and oversight, but I do think that that's a powerful example of what it is when there is something that people can literally go and say, I want my brother to tell me if he's okay, and I'm waiting for that signal, and I'm out here until I get it, or what, right? And then, but yes, culture change also has to happen, and happens because it's pushed from outside institutions as well. And that gets to people who can tell those stories, and how important that, and push the institutions and push government to actually do the hard work of changing these glacial institutions, because the only reason we've gotten where we are is because of organizing and community work, and because of organizations and justice-involved people that have made this in the forefront. I mean, 20 years ago, 30 years ago, this was not a conversation at the national level, at the local level. There was not coverage of what was happening in Rikers Island or in the country's jails. It was not, forget about it being something that, an elected official would even feel like they should make as part of their platform, versus trying to, shove each other aside to be the toughest on crime. All of that external culture change is because of people outside of government institutions that are moving the needle. And so all of those things together, when people ask me now, who I've now been working on this for many years, as I think all of us have, and it's like, well, what can I, how do I change the criminal justice system? And it's like, getting where you fit in. Like, there is so much work we have to do. Working within government to try to push and change culture, but there's so much that needs to happen outside of it too, for us to actually see transformation.
Thank you. Let's open it up to the audience. Anyone who has questions, raise your hands and we'll come around.
This question is addressed to Dana. One of the necessities for this closing Rikers is to try to get the population below 5,000. And while admissions to Rikers are declining as far as arrest, there's one segment of the jail population that's increasing, and that is parole violators. And now, the city certainly cannot tell the state what to do, but the city can say, you can no longer lodge these people at Rikers Island. Take them to Edgecombe. Take them to one of the state facilities. Why does the city keep allowing the state to lodge their parole violators at Rikers? Why don't you just say, no, you can't do it anymore?
That is a great question. So, first of all, yes, across the board, every different category of, we've seen a reduction in every different category of people who are in jail right now, other than state technical parole violators. And that state technical parole violators is people who have not committed a new offense or not alleged to have committed a new offense. They're just in for a violation of the term of their state parole. And that's over 700 people right now on a given day, which is a very high percentage of, less than 8,000 people. So one, I think there is currently legislation in Albany called the Less is More Act, which I know Just Leadership and other organizations are working on, which would be and the mayor's office and the mayor has come out in support of that, which would reform the parole system with the idea and the hope being to reduce that number altogether, right? So that we don't have over 700 people in detention for technical parole violations. In addition to that, what what we actually do believe is that there's nothing that those individuals could be housed in a different state facility within the 5 boroughs, right? We don't want people being sent further away. And so that is something that we supported. The city cannot do that without state agreement to actually house those individuals.
Can't say no to that.
We can't say no. So we would need agreement from the state to house those individuals in Edgecombe or Lincoln. But that's something that the city is supportive of. Fundamentally reducing that number, right? Parole reform across the board, support of the Less is More Act. But we would definitely be in support of also considering whether that population could be housed in a different New York City-based facility.
Hi. There's a common misconception that simply by decarcerating, savings are to scale. So to incarcerate someone on Rikers Island for 1 year costs nearly $220,000. There's a conception that, if we cut the prison population, then that's $220,000 less dollars per year per person, which isn't true due to the exorbitant overhead costs certainly associated with paying correctional officers, their pensions, their benefits. And right now, based on the statistics that were provided to us by Just Leadership, it notes that there are over 10,000 correctional officers for a population of fewer than 8,000 incarcerated people. Now, I'm not familiar with any correctional facility that has more correctional officers than incarcerated people. DeAnna, you mentioned MDC Brooklyn, not a name, but that was the facility that you were referring to. The employees there were shocked when I was describing to them sort of like some of these matters at Rikers. So my question here is, with these decarceration efforts, what are we doing with those extra 5,000 correctional officers? I mean, even a 1-to-1 ratio, quite frankly, is too much. In most systems, I'm not familiar, and I'm not saying I'm familiar with every system. I'm pretty familiar with the systems in New York, but I don't know of a system that has even a 1-to-1 ratio, let alone a 2-to-1 ratio. So what are we doing about that? And with the savings, the video made it clear that there are going to be quite exorbitant savings due to transportation. With those savings, what are we doing to reinvest that into the communities that are over-policed, those 6 neighborhoods, those $1 million neighborhoods that disproportionately populate Rikers Island and other borough-based jails?
So I can answer part of that question, and you're probably, some of you, better at answering the second part in terms of reinvestment, but Governor Cuomo closed a significant number of prisons under his tenure. So I believe it's 11 at the last count. And that was very difficult. And we talked about unions. DeAnna talks about unions. Governor Cuomo really had to fight the unions in order to close those wings, close those prisons. So that was a significant improvement, right? We had less people that we needed to incarcerate, and we were successful at closing those prisons, right? Because the danger there is if you build it, they will come, right? If you have more prisons, more open beds, the idea is, judges and prosecutors have those beds that they can send people to. So it's considered a success, and part of the deal was that a lot of these corrections officers wouldn't actually lose their jobs, right? But it's a complicated situation because across the country, most jails and prisons are tremendously understaffed. They just don't have enough medical staff, mental health staff, correctional officers, and that creates really dangerous situations. So having more correctional officers in these facilities, as long as the culture is not, if these correctional officers are, working under a human rights framework, you want to have more staff to keep safer, more secure facilities. But this is part of what happened in New York, is that very few correctional officers actually lost their jobs, and that was part of the deal that the union struck with the governor's office.
I think just also specific to Rikers, I think that's been one of the challenges of Rikers as an institution, and Homer can probably speak more to some of the, I don't know, but just the inefficiencies of Rikers itself, whether it's transportation and all of the, efforts and staff that's required to, bring people to the courts a couple hours away, or just the poor lines of sight, the very large housing units. There's a lot of staffing inefficiencies that has happened at Rikers Island. So I think what we anticipate is that when we're talking about smaller facilities with direct supervision, smaller housing units, and obviously far fewer actual people in detention, that we will be able to operate at a smaller system overall. We don't want to lose program counselors and correctional health services, like the level of care and things like that. But in terms of the number of staff overall, we do anticipate that it will be lower. I think we also have a lot of attrition right now every year of correctional staff, and so there's a way in which that can happen in a right sizing of the system. There's a very high attrition rate just every year. I think the opportunity of what does that look like long term is something that's an important thing for us all to keep in the framework, and I think that the justice reinvestment framework is an important one. So we're at this point, we don't have staffing numbers. It's premature for me as the administration to say this is what we expect the new staffing numbers would be and this is how it compares, other than we do know that a smaller system that is more efficient than Rikers and all of the challenges will have benefits from efficiency. And I think what we want to keep as the value is justice reinvestment is an important frame, and that we are all missing the boat if we're not talking about how do we actually reduce, or how do we actually improve public safety? And yes, that starts with neighborhood level investments. And so I think that's the way in which we're approaching it.
Here I go again, folks. In terms of the reinvestment of that funds that we're talking about, stop looking at it because it ain't coming. And I can give it to you as plain as possible. What they are doing is designed by plan. And I'll give you one quick example. We all know that college education stops recidivism on the state prison level. They took college out of prisons. When Judge Lippman was going around, who's the head of the closed Rikers Island Commission, and he did a listening tour, and he came to my agency as well as several other agencies. After he was done with his listening tour, I sat down with him for about maybe 15, 20 minutes, and I asked him the question. I said, Judge Lippman, you do understand that if you really, really wanted to, you can close Rikers Island next year. And he said, sit down, Barry, and give me an explanation why. And I looked at him and I said, you already have the mechanisms in place. You're just not funding them properly. You have your Alternative to Incarceration program, which is the largest running pilot program in New York City history, because it has not been brought up to spec to meet the needs of New York City criminal justice system. That's one for you. The second one is that in 1990, we closed down a whole bunch of behavioral health facilities. And there was a promise made to the community-based organizations that they would receive funding to shore up the closing of these facilities. The funding never came. So again, you also have substance abuse programs. You have inpatient, outpatient. You have behavioral health programs, inpatient and outpatient. All you need is the staff capable enough to go out on Rikers Island and do an assessment on every single person that you have there. I can guarantee you a large percentage of them are going to fall under behavioral health, as the gentleman was talking about. A large percentage of them are going to fall under residential substance abuse. Some of them are going to be outpatient substance abuse. The others, now, I'm a former incarcerated individual, so I'm going to tell you, the likelihood of getting everybody off of Rikers Island is not going to happen. There are some people that, because of their history and their nature and their criminal history, that they will probably be there for a while. But there's a large population of individuals that fall under behavioral health, substance abuse, that fall under going into inpatient programs, and certain situations, if they were funding these institutions up to par to meet the specs of New York City, we probably would not have even been in the situation that we're in today. You know, when they talk about supervised release, they're not talking about probation and parole only, they're talking about the nonprofit programs, which was mentioned here. But every year, and I've been doing this since 1991, every friggin' year, I go to City Hall and beg for money for my Alternative to Incarceration program, because we are on the block to be chopped. Every year I do this, and every year I get pissed off. Why should I have to come to City Council and beg you for money when you know that this is helping to reduce crime in New York City? Why should I have to come to you every year and beg you for this funding? Because that is the way the system is designed. I must go every year and beg for money that they know is benefiting the people of their city, and they refuse to fund it properly. And I ask myself every year, why do I have to come here and beg for this money? Because we know it has reduced the crime in New York City. That's not to say we haven't had some bad situations just like everybody else. I'm not somebody who's going to sit up here and lie to you. We've had people that were out on parole that reoffended. We have people that were out on Alternative to Incarceration programs that have reoffended. But when you compare them to the successful amount of individuals that have never had criminal justice contact again after entering these programs, we blow that number out of the water. And that's what I'm talking about when I say it's by design. I'm not saying anybody is responsible for that design, but somebody put it into design. Because you can't have all of these situations happen simultaneously without somebody driving the engine on it. Thank you, people.
Hello. First of all, I want to say thank you to the panel for giving us all your perspectives. Especially Mr. Barry, I really appreciate your perspective. So I'm under the perspective that no investment into jails and prisons is an investment into poor Black communities, and particularly in New York, it's not an investment into these communities that have been affected by mass incarceration. And then to see that in the new Rikers plan, or the new jails plan, that they would have commercial real estate, there would be stores and opportunities for people to have businesses in there. My concern there, two things, is that one, communities that have been heavily impacted by incarceration are then now having to become reliant on jails and prisons for jobs in those same communities. That's one concern. And the second concern is that while we're opening up these stores and these new facilities, are people that have already been affected by incarceration and criminalizing these communities, are they going to have, first dibs on setting up those stores, or are they going to have first dibs on how the revenue from those stores are going to be spent? And basically just thinking about how the revenue that's going to be generated from these new facilities, or even the savings from closing down Rikers, how they're going to be affecting or benefiting the communities that have already been harmed.
So that is, I think, the specific question for folks who might not be aware of the plan is that in the 4 proposed facilities, there's about 20,000 square feet on the ground floor that is for a more public-oriented use, basically. And so what that is yet to be determined. It's essentially public-oriented use that is community-facing, that anyone can have access to. There's a lot of reasons for why that's in there. For instance, like I think people are familiar with the Brooklyn House of Detention on Atlantic Avenue. Atlantic Avenue is a very,
major shopping district.
Yeah, just like a long pedestrian kind of thoroughfare. And then you get to the Brooklyn House of Detention, and it's a big wall along the entire street. And then there's, the next block. So it was one of the things that we've been trying to do is hear from the neighborhoods about, well, how are these facilities kind of integrated into the neighborhood, and how do they not kind of stick out like these fortress-like environments? Now, what actually happens in that 20,000 square feet is a question to be determined, and the city set up neighborhood advisory councils that have members of neighborhoods, justice advocates, local service providers, community boards, and one of the things that they have been doing is making recommendations about what should happen in that square feet. So I'll say the recommendations are not at this point that we're hearing about kind of a commercial store. For instance, the recommendations that we're hearing in Brooklyn is possibly some type of, and in Brooklyn, they're, specifically saying, look, and, there's lots of retail on Atlantic Avenue, but also small businesses are struggling and retail is closing. So what we don't need is, more commercial stores. We've heard we'd like to see, ideas in which maybe there's some type of nonprofit incubation space or some type of jobs program where formerly incarcerated individuals would have some type of training or access point to it. In the Bronx, we heard similar things. So it's, the input that we have been getting from the neighborhood advisory councils is really what's going to ultimately help inform what happens in that community space. But I'll say that what we've been hearing to date is not a kind of, it's not Starbucks. No, that's not what people are suggesting. It really is about either things that currently are lacking. So for instance, in the Bronx, there's been a real desire for a supermarket or something like that to serve the neighborhood. So that's one of the pieces of feedback, is that if that could help address some of the issues around access to healthy foods, that would be potentially a neighborhood benefit. But the other things that we're getting are in things like job training, support for different community service organizations that could use some nonprofit space that might be serving, justice-involved individuals, but also might have programs and, services that go far beyond it. And so I think that's kind of the range of things that are being considered.
We have time for maybe one more question.
This is for, I don't know your name, but the physician on stage, you mentioned CMS earlier and how they govern the hospital as well as the Joint Commission. Some hospitals even have a justice unit where the incarcerated are able to go to the hospital and get care. So now that they're not isolated to an island and now they're in the boroughs, how will that change? Will they go to the hospitals more often, the local hospitals, or will we put more transparency on those institutions so CMS and the Joint Commission would have a voice in how those facilities look?
So we have long had the benefit of a very good forensic unit at Bellevue Hospital for patients who need inpatient medical and psychiatric care. And so that unit or that capacity won't change, and then the women go to Elmhurst. So having access to nearby inpatient medical services will continue. It will be different because it may mean, I think the ink is not yet dry on where people will go, but we've had access to very good levels of care. I think that the most concerning element of this for me is that everything that happens outside the hospital, CMS and the national experts like the Joint Commission, we don't rely on them to tell us what's quality care and what's not quality care. Now we have the benefit here of the health service being part of the public hospital system, so that's very good. We have, I never worked for a commissioner of corrections. I wouldn't. As a doctor, I always reported to the commissioner of health when we were the DOH or the president of New York City Health and Hospitals. So we have much more transparency on the health service here than other places. That will continue. The problem is that most places in the United States don't have that. The health service works for the security service. And so to the extent that the security service says this narrow scope of care is okay, or we're not going to report injuries or preventable deaths, then we never hear about those outcomes.
Hi, from my understanding, this is not a done deal, and it still has to be voted on. What's being done to make sure to push it through? Because from my understanding also that if it doesn't get voted through this time, it's going to be a huge uphill battle to get it on the docket.
Yes. Another great question. So, yes, this is not a done deal. We are going through the public approval process right now. In New York City, we have something called ULURP, which is the Uniform Land Use, review procedure. That's not exactly right, but Land Use Review Procedure, thank you. So it is a process by which, a process by which, that we are now basically moving through the public approval process. It is first considered by the community boards. There's 60 days in which the community boards are reviewing this project. I should say that it's going through as one ULURP because it is a ULURP to close Rikers. So this is a citywide criminal justice reform effort. It is going through as one package. At the end of it, it is so that we can close the jails on Rikers Island. But each community board that is impacted in each respective borough is holding their own hearings on the issue and making their own vote. The community board vote is advisory. It then goes to the borough presidents, who will also issue an advisory vote. Again, each borough president in the 4 boroughs that have proposed facilities will be considering it independently, or considering their project independently. It then goes to the City Planning Commission, and it then goes to a vote of the City Council. And so, I think many people have said that if this plan, fails, our effort to close Rikers is set back generations. And I think that, it was an important, I think someone in the film said Rikers should have been closed decades ago. And part of it is because it's hard to close Rikers. But it's important work. And so I think one of the things that has been really powerful, and a lot of the advocacy organizations such as Just Leadership, what people have really been doing is saying, look, there's ways in which people want to see the plan improved. As the mayor's office and as the administration, we have to be responsive to what neighborhoods and different organizations are telling us is how we can improve the plan. There's changes that have already been made to the plan. So we've reduced the number of beds in terms of how we consider inefficiency. We have changed how we're contemplating treating or housing women in a borough-based system because we received a ton of feedback from different women's service organizations, and we did focus groups at Rosie's and focus groups with staff, and listen to the fact that people said, actually, we don't want them in 4 facilities, we want women in 1 facility, and that is a change that we made to the program to say, okay, we hear you, we want to reflect that. We have brought down the height of each of the proposed facilities. There's a lot more work that we have to do and will be doing and are doing right now from the mayor's office to make sure that this plan is the best possible plan. We have a feasibility study underway to look at whether some of the people that have acute and complex medical, mental health, and behavioral health needs could actually be housed in a completely different type of environment that is more of a hospital than a detention facility. So that's that's something that we're looking at right now. But I think it is very important that for people who agree that this is part of essentially how we get to the closure of Rikers, that we not ignore the fact that there's actually a very important public review process underway on our on the mayor's office website, we have a Close Rikers site, nyc.gov/Close Rikers, that if it doesn't already have it, will shortly have a list of the upcoming community board meetings on it, but I'll just say that there's one in Queens tomorrow night. There's one in the Bronx on Thursday. There's, I think a lot of people who are, coming to the community boards that have really, legitimate neighborhood level concerns that obviously we have to be responsive to. There's also, certainly some people who are just kind of fundamentally questioning, is it right to close Rikers Island altogether? And it's very important, I think, for just the justice reform perspective to be front and center on this as it continues to move along.
One last question to wrap things up. First of all, thank you to all of our panelists and Kirk for bringing this dialogue to NYU. I think I speak for everybody in the room when I say that we are so grateful to have you here. And my question for you is, for those of us in the room that are feeling compelled to do more, what are the opportunities for engagement? What can we do to help continue this dialogue out in our communities out in New York City? You mentioned the meetings, but if you could speak just briefly about that.
I bet a lot of people have things to add, but so I will just. So one can go to the meetings, but two, people can also contact and write letters to community boards and council members and borough presidents. So not everyone necessarily is able to make it in person to a community board meeting, but it's really, I think, helpful and important to actually just send emails, let people know. I would also say then, obviously there's a lot of great community organizations in this city. Just Leadership, and I think DeAnna had to leave, but Just Leadership is just one. They're a great one, but there's organizations such as Fortune. We've got, I think, a great in New York City, a wealth, and it's part of why we've seen reform to date is because we've got great alternative to incarceration programs and reentry organizations like Fortune and Osborne and Friends of Island Academy, and the list is, goes on and on and on. And we've got great advocacy organizations like Just Leadership and Catal, that are doing a lot of that frontline work. And so, I'm sure that there's a million different ways that people can plug in and support them, but also just getting this message out and telling other people and educating folks on the issue is so important as well.
And I think, if there are any people in the room, or if you have, friends or family who own businesses who can hire formerly incarcerated people, we do such a bad job of that in New York and across the country. I think the statistics indicate that half of people who are released from prison within 1 year, this is across the country, do not have a job, right? And we know that having a place to go every day, having an income is so important to support your families and to feel valued as a person. And we really need to involve the business community very quickly, I would say, to start hiring formerly incarcerated people. And it's something that in New York and across the country we're just not good at.
The only thing that I would say to everybody is have a conversation with your friends and your family, because that's where the change is going to come from. As I do these panels, and I've done them across America, I can honestly tell you this: New York is one of the most progressive cities in this country when it comes to criminal justice, and that's sad to say, but it's true. It is true. The other thing that always makes me upset is that this auditorium should be packed to the gills with standing room only. And I'm just being honest about that. And it's not. So we need to educate our friends and our family about what's really going on. Because believe it or not, there is a whole lot of people out there that have no criminal justice contact, and they have no criminal justice knowledge. I challenge you to help them get criminal justice knowledge. Not the contact, but the knowledge. Thank you, everyone.
Thank you. You have all been phenomenal. I'm just going to say a few words, and then we can really just kind of honor our panelists again and kind of close out. And I think everything they echoed is so important, right? It's like where do we go from here? How do we make sure that this conversation doesn't only happen in this space, right? And one of the things I want to really just put in context again is that, maybe I'll start by just reading a quote, right? And I think this quote speaks a lot. Black men born in the US and fortunate enough to live past the age of 18 are conditioned to accept the inevitability of prison. For most of us, it simply looms as the next phase in a sequence of humiliations. Being born a slave and in a captive society and never experiencing any objective basis for expectation had the effect of preparing me for the progressively traumatic misfortunes that lead so many black men to the prison gate. I was prepared for prison. It required only minor psychic adjustments. Going back to what Barry said, it's important that we understand the history of prisons in America. It's important that we understand the history of prisons from people who have been impacted by the system. This quote was from George Jackson. It was a quote in 1970. And George Jackson was probably one of the most famous political prisoners ever. And much of what he spoke about is essentially the experience that we're having today of mass incarceration. And I want to say justice by design doesn't start with better prisons or jails. Justice by design starts when we begin to ask the questions of why. Why? Why are more black men incarcerated today than were enslaved in 1850? Why are people of color overrepresented in the system? Why is it when you think of a criminal, you would think of Barry and I immediately? When in the history of this country, nobody has robbed, raped, murdered more than white men. So if we want to create paradigm shifts, it starts with us really being willing to sit with the truth. Again, right, the truth of what these systems are. It really needs us to acknowledge that capitalism is a system that perpetuates exploitation. The system of incarceration is a very beneficial economic system. So many of the things that we feel don't work actually do work and have worked. Eddie Ellis, who was very instrumental in pushing this conversation and humanizing this conversation, famously said, if any other business had as many returns as prison, they would go out of business. Whereas this system actually benefits from its returns. I'm not only a professor at NYU who speaks about this. In 1994, at the height of mass incarceration, I was entrapped and enslaved and spent 6 months in Rikers. I was charged under the Rockefeller drug laws. Possessing or selling as little as 4 ounces of cocaine was on par with murder. As a first-time offender coming into the system, I thought the system would say, hey, why are you here? That did not happen. My humanity has never been seen in this system. In 1776, we had the Declaration of Independence that said, all men are created equal. That is never applied to people like me. So if we're going to shift cultures, if we're going to create something new, it actually starts with us actually acknowledging what these systems are and what the culture is. Anti-blackness is endemic in America. Anti-blackness is endemic in America. And that's why we can have these systems and no one blinks an eye. This is not a new conversation. As someone who, again, went to prison in the 1990s, I think about just like hip-hop in the 1990s. Wu-Tang Clan, 40 of us in the back of a bus. Life is a shorty, shouldn't be so rough. But as the world turns, I learn life is hell. Living in the world no different from a cell. Right? Tupac's, like, who would think in elementary I'd see the penitentiary? Naz's, what up, son? I know it's rough doing your bid, right? Like, we've been talking about this. So if we're really going to change, and if we're really going to do something better, it means that we have to start listening. We have to start listening to the people who have been directly impacted by these issues. Public safety will never happen if we don't radically reconceptualize our society. I'm going to say that again. Public safety will never happen if we don't radically reconceptualize our society. So much of this work, as Angela Davis has said, it really begins with our imagination and our ability to think outside of these systems. So as we leave here today, I ask that you really begin to sit with these conversations. You really begin to bring these conversations into your spaces, right? Because as Barry said, this room should be packed. This is the most preeminent social justice issue in America. It impacts every facet. Everything is impacted within the system. Mental illness, substance use, and we haven't talked about trauma, right? Think about the impact for people and communities within these systems, right? Trauma, our understanding of trauma comes from war. When people came back from war, we realized that there was an impact. Yet it was post. There has been no post experience for people of color in this country. So we haven't even begun to quantify the impact of trauma within these systems. When I think about substance use, we haven't even begun to think about how people are coping with their trauma. I remember a good colleague, Casimiro, who'd been arrested over 50-something times, right, said to me one day, he said, you know what, I've been in and out of rehab my entire life, and it's never worked. Because it's not about the drugs, it's about the trauma that I'm trying to get away from. So again, there are no single issue issues, as Audre Lorde famously said, right? Like, we have to have an intersectional conversation, we have to be willing to have a historical conversation, and we have to be willing to have a true conversation if justice is ever going to exist in this country. I would love to really thank our panelists for bringing their expertise to this conversation, and I really